Hi, my name is Congressman Sessions.
And hi, I'm Congressman Pete Sessions, and we're from Dallas, Texas.
Like so many people, I am a full-time mom with a full-time job, and my life is truly a balancing act. When Pete goes to Washington, I know he's there fighting for families and moms, just like me, who are doing their best to make sure our kids are safe, the bills are paid, and homework gets done on time. Being parents is hard work, and our government shouldn't make life more difficult for families like ours and families like yours. Like many parents, we worry about our family's health care costs. As a member of Congress, Pete is legally required to be on Obamacare. Now, in the 6th year of Obamacare, it has become more apparent than ever that Obamacare is failing to meet the promises to the American public and to the members of Congress and their families. Before we were forced onto Obamacare, our health care coverage was affordable and worked great for our family. Now, under Obamacare, our family was unable to keep our preferred plan. Our premiums doubled, and with a deductible of $3,600, our out-of-pocket expenses have grown. In addition, some insurance companies have announced that their rates are expected to rise as much as 60%, while others are simply dropping out of the marketplace altogether. I know firsthand how hard Obamacare is on our families, especially with young or disabled children. If I felt ill, I'd probably not be covered under a subspecialist at leading-edge hospitals in Dallas, Texas, nor would I have access to some of the best clinical care and research in the nation. And God forbid, if anything were to happen to my sons, it quite likely would be a completely out-of-pocket expense at many children's hospitals across the country. Such narrow networks are proof of how Obamacare has deceived so many patients, especially the chronically ill, forcing them into a race to the bottom.
As you can see, Obamacare is not working for families. It's not working for businesses, and it's certainly not working for healthcare providers. It's easy to understand why doctors are concerned about being able to provide their patients with quality, affordable care. Medicare only reimburses them about 80% of what private insurance does, and Medicaid cuts an additional 34% from payments when treating those below the poverty line. Astonishingly, Obamacare plans reimburse up to 50% less than other private coverage. This law has placed burdens on every individual in the healthcare system rather than it working for the people it was intended to help. Obamacare has become a concrete life preserver, overwhelming all insurance plans in America.
American families need a solution. That is why for 18 months, Pete has been working with doctors across the country and with United States Senator Dr. Bill Cassidy from Louisiana to create an alternative that provides more health care options for all Americans. From the beginning, I told Pete to think about women like me and like you who have responsibilities to keep their families healthy and happy. Pete took these ideas and turned them into a real, workable solution that strengthens our healthcare system and empowers all families and individuals to make the healthcare choices that best fit their needs.
That's right, Karen. Senator Cassidy and I wrote what we call, and what I believe truly is, the world's greatest healthcare plan. We took the 12 best pro-consumer ideas and turned them into a real legislative solution. The world's greatest healthcare plan creates a sustainable, non-discriminatory, free market-based system that ensures that not one more American is forced into Obamacare. And best of all, it's not a use it or lose it plan that simply starts over every year. Our plan makes a promise that we can keep. If you like your doctor, you can keep your doctor. And if you like your own health care plan, you can keep that too.
Thank you for allowing us to take a few minutes of your important time to explain this common sense, patient-centered healthcare plan.